Today, like many of you, I learned the cause of Catherine O'Hara's death. Sadly, she died from something called a pulmonary embolism. She was diagnosed with colon cancer, and cancer can increase your risk for clots. Clots specifically that can travel from your leg to your lungs and cause a pulmonary embolism. I don't know if you all remember when Heavy D died, and they said he died of pneumonia. They said all these other things, but it wasn't any of those things. He died from a pulmonary embolism. This is something that abruptly can cause death, especially if it's not recognized. Now, it is something that is high on the radar of emergency medicine physicians. And so a lot of times when folks come in and they have symptoms of a PE, fast heart rates, shortness of breath, or their oxygen level is low, or they have risk factors, they've been traveling for a long period of time, or they have cancer or any other risk factors for clotting, then they'll go through something called a CT scan. And in that CT scan, you'll be able to tell if there is a clot there. Now, the way that it can cause death and be extreme is that you can block off the arteries in the lungs. When you block off the arteries in the lungs, then you are preventing blood flow going from the heart to the lungs and back. So you are stopping this circuit of blood that comes into the heart, to the lungs, back to the heart, to the rest of the body. So you can develop something called a massive PE, which means your blood pressure just drops significantly because you're not getting blood flow because there's this huge, gigantic clot in the artery that is preventing blood flow. This can be very, very devastating. So again, risk factors: if you've been on a long car ride and you notice that one leg is more swollen, you want to let your physician know to be screened for this. Or if you've been diagnosed with cancer, or if you've had a recent surgery and one leg is swollen, or you're more short of breath, you notice that your heart is racing, things like that. Those are signs of a potential PE. You want to let your physicians know about it. I hope this is all helpful, and you all take care.